Clayton will provide today's case update.
Good morning, everyone. Today we're reporting 36 new positive cases. We also have, with that, 5 new hospitalizations. We have 6 new individuals who have recovered from COVID-19. We are reporting no new deaths. And we have an additional 314 individuals who have tested negative for the COVID-19 infection. In total, that brings our case count in South Dakota to 165 cases. We have 2 deaths. We have 57 recovered individuals, and we have 17 total hospitalizations. I'll give you the rundown of those new cases by county. We have 2 in Brown, 1 in Coddington, 1 in Davison, 1 in Hughes, 1 in Lake, 3 in Lawrence, 6 in Lincoln, 14 in Minnehaha, 1 in Pennington, 1 in Spink, 1 in Turner, 2 in Union, and 2 in Yankton. The breakdown of individuals by age range include 7 in the 20 to 29 year age range, 7 in the 30 to 39 year age range, 5 in the 40 to 49 year age range, 6 in the 50 to 59 year age range, 6 in the 60 to 69 year age range, 1 in the 70 to 79 year age range, and then 4 individuals who are 80 years of age and older. The breakdown by sex includes 10 cases that were male and 26 that were female. The other thing that I want to mention for the community impact map is that we do have 2 new counties that will be light blue. Those will be Roberts and Spink, and that we have 2 that will be dark blue, which is Lawrence and Lincoln. And with that.
All right, well, I'll go ahead and unmute all the lines, and then you'll need to hit *6 and able to ask your question. All right, we should be able to, by hitting *6, you should be able to unmute and ask your question.
This is Jody Heemstra at Dakota Radio Group in Pierre. The new case in Hughes County, this is Jody Heemstra at Dakota Radio Group in Pierre. Just wondering if that case tracks back to the inmate at the women's prison who is positive, or any of the 9 that walked away and 7 of which are back in custody.
There is no association that we have for either the individual, for any of the other cases that have been identified in Hughes County. So it's not associated with that at all.
And also, do we know how long does the virus live? Can it live on things like paper, boxes, mail, that kind of thing?
So the virus can be found in the environment, and usually that is up to about 3 days on surfaces. It does vary by the type of surface. So hard surfaces that are non-porous, like metal and plastic, it survives upwards of that 3 days. For things where like paper and cardboard and stuff like that, the survivability of the virus is much lower.
This is Kim Malson-Rice, and I would add that the main route of transmissibility are droplets from infected people.
Next question.
Yes, this is with the South Dakota Mail newspaper. I have a question in regard to our hospitals in South Dakota. Dr. Clayton, how many hospitals do we have currently in South Dakota that would be capable of treating COVID patients? And then are they all in readily positioned to do so?
So this is Kim Malsom-Risden. We are actively working with all hospitals across the state to assess their capabilities, both physical space-wise, staffing-wise, and equipment needed to treat individuals with COVID. Of course, there will be people that still need hospitalization that don't have COVID, and so that is part of the work that we are doing to assess as well. We will be doing surge planning with all of those hospitals to ensure that we are able to meet the expected demand.
Thank you.
Next question.
This is Joseph Barkoff with the Capital Journal, please.
The Capital Journal.
Thank you. So this is kind of a multi-parter. I'll try to do it quick. Is there more than one version of the virus? Are there mutations, or is like the same? The people with asymptomatic, mild, and moderate, are they all affected by the same version? And with the new rapid ID to be deployed, update on that would be great too. But with that to be deployed, is everybody going to get tested so you can find the asymptomatic people and get them weeded out? Like, will that help a lot? Thank you.
So, yep. So the answer to your question is that no, there is no co-circulation of two or more viruses. That the COVID-19 is the single virus. Just as a generality, viruses have a little bit of variability in their genome, but nothing that is causing differences in presentation or anything like that. That the virus that we're seeing in South Dakota and different parts of South Dakota is the same virus that is being seen all throughout the United States. And so the focus of individuals is that when they become symptomatic is when we conduct testing. We do focus on that because individuals who have symptoms are at much greater capability of transmitting the virus to other uninfected or individuals within the community. So the focus for testing has been and remains individuals who are symptomatic with COVID-19 symptoms, which includes fever or cough or shortness of breath.
Next question.
As a quick follow-up, asymptomatic doesn't mean they can't be contagious, right? Or is asymptomatic also not contagious? Because yeah.
Yeah, so individuals who have asymptomatic infections do have a lesser capability of transmitting the COVID-19 virus. The focus, though, is on individuals who are showing symptoms because those folks are able to transmit the virus at a much higher level. They have much more virus to shed, and so they have a greater potential of infecting other individuals in the community.
All right, let's go to another caller.
This is Jackie with
quick question. Megan Ransom, News Center 1.
Jackie, I heard a Jackie. Let's go with Jackie first.
Thanks. I'm wondering if any of today's new cases are connected to the potential exposure at Monument Health from last week.
The investigation that we have is ongoing. What we don't typically identify specific exposures like that. The focus of our investigation is around did the person travel? Did the person have contact with another known case, or whether it's community acquired? And so at this point, we have not tied back any of the infections, as part of a cluster or a concern of cases, grouping of cases within that community or within Pennington County.
Next caller.
This is Mark.
Hi, this is Trevor Mitchell with the Argus Leader.
Trevor, go ahead.
Yeah, I was wondering, a couple days ago talked about the status of a delivery from the national stockpile coming in. I'm wondering what our PPE, the state's PPE stockpiles are looking like, how we're doing on stuff like gowns, face masks.
This is Kim Alsam-Reisen. We did get some deliveries from the Strategic National Stockpile. We've gotten several this week. We are still looking to procure needed supplies, and so we're using, potentially outside suppliers as well as continuing to work through the FEMA process. We've been able to keep up with requests fairly well. We will be, continuing our efforts to secure the right types of gowns, additional face shields, and equipment like ventilators.
Do you have a number on how many ventilators the state has?
We are assessing that right now with our hospital partners. It's a little bit more complicated than just the number of ventilators because we have to look at things like anesthesia machines and other equipment that can serve kind of in the role of helping individuals. So I don't have a concrete number for you right now, but that is part of our assessment process.
Okay.
Next caller.
Megan Moran, AM Radio. Can you speak to how many, on the state's website, pending tests have been 0 for several days. Can you speak to how many tests, both positive and negative, are being run at the state level?
So this is Kim Alsam-Reisen. That varies. We run all of the high priority tests that we receive by 8 a.m. That same day. And so we have been able to keep up with the demand of the high priority tests that have been sent our way. The number of that varies just on a daily basis.
Do you have the records for the past several days on how many have been run on a daily basis?
I can tell you the range has been between 10 and 40.
Thank you.
This is Mark with the Pioneer.
Go with Mark.
Thank you. Derek, I sent you an email the other day. I was hoping you might be able to reply today. And then also, Governor Noem has stated about 30% of South Dakotans could contract COVID-19. How many, what are the numbers of dead that you are expecting in South Dakota? And then I have a follow-up question too, please.
Okay. This is Kim Alsam-Reisen. I'm going to reiterate what I said in the press conference yesterday, and so I want to make sure people really understand this. The modeling that we're working with, which is the most consistent across other models, includes an infection rate of 30% of people. 80% of those people will have mild symptomology and will not require, are not expected to require advanced medical care. The death range of cases, not of the population, of cases, for the models that we've looked at ranges from 0.5% up to 2 or 3%. So we are still working on that modeling, but if you have questions on that, please do indicate.
This is Pate Hudson from the West River Eagle. And the question that I have is, we're expecting, based on DNBI modeling on the Cheyenne River Sioux Tribe Reservation, somewhere in DNBI is disease non-battle injury. It's the military's assessment of how an area would need to respond. The median of 6%, our margin of error of 6% is 52% infection rate. And on Cheyenne River, with a population of roughly 8,500, there's 4,020 expected cases. How is the state going to handle the surge? Because IHS is not prepared to handle, they only have 12 beds in that hospital. How is the state prepared to handle the surge of the citizens who are coming off the reservations into the hospital system when you're expecting 19,000 cases in just a few weeks statewide, according to the same model you're talking about? So what are you guys doing to
this is Kim Alsam-Reisen. Yeah, I'm not sure what model you're referring to, so I can't speak to the numbers that you just cited. But I can tell you that we are actively working with all hospitals across the state, including IHS, to determine their ability to surge, to build additional capacity where needed, and to ensure that we have equipment and additional staff available to the extent that that's available. So, we'll be sharing more about the numbers that we're surging to in the coming days as we finalize those models.
Okay, to be clear, that's the same model you're using, and
no, that's not the same model that we're using. I want to clarify that. I don't know what model you're talking about, but that's not the model that we're using from the numbers that you just shared.
Thank you.
All right, we have time for just one more question.
Sue Bergheim, KJAM Radio.
Go ahead, Sue.
Just a quick question on the Lake County case. It's our first one. I'm just wondering if you can provide for me the age group and the sex of the individual.
The information that we provide is on the website. We do not focus on providing information across all of those tables for a specific county, but you can go and take a look at the numbers that are on the website for individuals within a Lake County as a total case, and then the overall age range and sex for individuals that are our new cases and our total cumulative cases.
Okay, and then I have been looking at that, and it does. We are not put on the map as community spread. So does that mean that it may be travel related then?
So you are correct that we focus on either travel related or the person may have been a close contact to a COVID-19 case that had been previously identified in South Dakota or elsewhere in the United States. So there is no community spread at this time.
Okay, thank you.